I was very active. I liked to jog. I was very active with my children, my grandchildren, and I just had a normal lifestyle. I began to feel like I had, when I would jog, I thought maybe I had not stretched enough or had pulled a muscle, so I just kind of like played it off. And then eventually it got worse to the point that I could not walk like maybe 10 feet. And so I decided that I better seek out some medical care. And they said, oh my goodness, you have vascular peripheral artery disease. Since you have, I guess, 3 main arteries going down your leg, and 2 of them are completely clogged in my left leg at the present time. And the 3rd one is partially open. They would have to take my left leg off, and I'm asking them, how far do you take a left leg off, a leg off? And they said it would probably be right below the knee. It's kind of like you're going to a state of shock. I mean, I have to digest. You know, you had to think about, I thought about cancer victims and leukemia victims, and when they were told, HIV people, when they were told that they had these terrible things that could not be cured. And I'm like, okay, ARSENIA, if you have to do this, it has to be done. But, you know, I just don't believe in giving up. I don't deal with negativity, so I'm a fighter.
I have seen studies, especially with peripheral vascular disease, patients that have been treated with stem cells, that were not a candidate for revascularization because they're poor healing potential, and they were able to regain the healing potential and able to save them from going for a full amputation.
I did the stem cell. It was a blind study, and I didn't know if I had placebo or stem cell at that time, and a year later they told me that I had gotten the stem cell. And I've been able to walk, jog, bicycle, skydive. I have my leg, I have my life back, and I'm always a firm believer that hard work makes your dream work. So my dream was to keep my legs.